Know more, care more. Addressing the world drug problem requires responses that are based on facts, solidarity, and compassion. Some 35.6 million people suffer from drug use disorders globally, according to the 2020 UNODC World Drug Report. Around 269 million people used drugs in 2018, up 30% from 2009. While the increase reflects population growth and other factors, drugs including opioids, cocaine, and methamphetamine are still more available, more diverse, and more potent than before, posing greater health risks and complicating efforts to prevent and treat drug use disorders. Adolescents and young adults account for the largest share of those using drugs. Of the 11 million people who inject drugs, half of them are living with hepatitis C and 1.4 million with HIV. Only 1 out of 8 people who need drug-related treatment receive it. 1 of 3 drug users is a woman, but women represent only 1 out of 5 people in treatment. Over the past decade, the total number of deaths due to opioid use disorders went up 71%, with a 92% increase among women compared to 63% among men. People in prison settings, minorities, immigrants, and displaced people also face barriers to treatment due to discrimination and stigma. All over the world, we see that risks and consequences of drug use are worsened by poverty, limited opportunities for education and jobs, stigma, and social exclusion, which in turn helps to deepen inequalities, moving us further away from achieving the Sustainable Development Goals. The COVID-19 crisis has intensified these challenges further still, overwhelming health systems and exposing gaps in social safety nets. The theme of this year's International Day Against Drug Abuse and Illicit Trafficking, Better Knowledge for Better Care, highlights the need to understand drug dynamics trapping so many millions of people in a downward spiral to inform balanced, health-centered solutions that are based on scientific evidence. In the COVID-19 recovery, we need all countries to show greater solidarity and shared responsibility to address the world drug problem. We need civil society and youth organizations to continue their efforts to support the vulnerable and their communities. Together, we can pursue more effective prevention and protection to build resilience as we build back better and leave no one behind.